Welcome back, everyone, to the Dr. Shana Show. My name is Dr. Shana Powell. I'm a naturopathic doctor in Montrose, Colorado, and owner of West Elks Wellness. This week, we're going to talk about foot zones with a friend of mine, Leslie Schroer. Oh, good, I said your name right. So, Leslie, tell us a little bit about yourself and what a foot zone is.
Myself, I kind of had my remembering in about 2010 or somewhere in there. And it started with energy class. It was a 2-year class that just brought back so much that I had known in the past, and it was very wonderful. From that, I progressed through some various other modalities and stuff, which, are in my toolbox. But the foot zoning showed up in 2017 is the first time I heard about foot zoning. By 2018, early days, there was actually a gentleman with the school that I learned from was coming to Colorado and teaching it in Grand Junction. And by the time I found out, it was like already the third class in, but he's like, "Oh, you're in. Don't worry about it." So it was learning the technique, and so for me, it's really great because I liked the touch, and being able to. And feet is I'm a Pisces. Feet are a thing, I guess, for Pisces. I've been told.
Okay, interesting.
Whatever.
Yeah, I'm not bothered by feet.
Not like I'm weird about.
No, but like you don't mind them. Like some people are like really grossed out by feet or like have weird like don't touch. Yeah, and I do physical exam and I look at everybody's feet and it's just people are like, oh, my doctor has never looked at my feet, and I'm like, I don't know. You never know if you get a sore or something. I just need to make sure you're taking good care of your feet.
There's so much information in a foot.
For sure.
And that's takes us around to the foot zone. It correlates to everything in the body. If you've heard of reflexology, that was discerned in modern technique around the same time the foot zoning was coming in. Cool. It's been around, both of these things. Foot treatment has been around for a health modality forever.
Yeah.
It's just never been coined or trademarked or anything like that until more in our recent times. So the signals points for both of those modalities are very, very similar.
Cool.
The difference between it is that the foot zone has broken the foot into areas of the body. So if you imagine a line coming up your body from each of your toes and your fingers, and all tracking up, where that's intersecting is the zone that we're in.
Oh, interesting.
So there's 4 zones. You have the top of the foot, of course the lateral, the inside and outside of the foot, and the bottom of the foot. So like the top of the foot correlates to this part of the body. So we're working on medial pelvic area up into rib and side thoracic, neck, shoulder. The outside of the foot is the leg, so it's tracking up the side part. So we're working arm and leg. Medial part, you get into reproductive, and then you get to the bottom of the foot, and that's the organ systems and the specific organ signals. And there's a lot of energy exchange going on too. This particular school has incorporated, I believe, that the energy body is one of our bodies. There's the emotional, spiritual, physical, and mental, and the energy body. So, we do chakra balance. We've got 22 movements on the brain.
Wow.
The big toe is the brain, by the way. So if your kid's not sleeping, try
rub on
little
the big toe.
Lavender oil on the big toe.
I'll keep that in mind.
Snoring, it's supposed to be really good for snoring too.
Okay. I mean, the foot zoning has been really profound. My husband broke his foot back when he was in high school and just has like a knob, like really broke his foot. And, he almost always like, oh, my foot's kind of bothering me after a day, even if just a short walk sometimes. When he was seeing you regularly, I didn't hear a peep about anything. And your treatment, when the biggest symptom I had when I was pregnant was I had that rib pain, if you remember.
Yes.
And your treatment was one of the only things that would help that go away.
Yes.
Like help resolve it, which, was so great because that was the most unpleasant sensation. Ribs being pulled apart.
Yeah.
So people that get the treatments regularly can notice one-off treatments are helpful too, though, yeah?
Yes, they can be. I think so. And when I'm working with somebody, I'm not in there to try to change things for them, who am I to say what is right for them?
Totally.
You know, so but it's there to assist the body, and what the body innately already understands it needs support with.
Yeah.
So that's my attitude, is let me just do this. Let's see what it's going to do for you. And you're talking about your ribs, you know, we do work with the diaphragm. And the diaphragm to me is important because I think a lot of acid reflux and GERD and stuff like that
100%.
is diaphragm. It's not, you know, it's that cardioesophageal valve right there at the stomach and the esophagus. And you know, that thing gets out of whack.
It does.
It's attached to how many vertebrae on our spine?
A lot.
Yeah. So you know, you're doing spinal alignments or...
Well, and then we're sitting like this. Like, I'm glad that you bring up the reflux because, you know, it's one of my favorite topics. We got a hole in the diaphragm. We get where your esophagus jumps down. The cardiac sphincter is also known as the lower esophageal sphincter. And you're sitting like this. You're putting so much pressure right on that spot. And so then we have a weakened diaphragm because we're not using it. And it's just like all this like compound effect. The number one thing that I find for people suffering with severe reflux, doing diaphragmatic belly breathing.
Oh.
And it changes people's
Yes.
outcome. You're going to take a PPI for that? That's not going to change that. You have to do it yourself.
Or they tell you have too much hydrochloric acid in your
Rarely.
stomach.
Occasionally it happens,
I'm sorry,
but not often.
That's an acid that's getting off of the proper tissue.
Mm-hmm.
So you get the burning because that tissue wasn't made to
No, that's
to deal
the
with
stomach
that.
is supposed to have acidity. Yeah,
Yes.
we'll get into the weeds, but the Bravo test I don't like. That's the conventional test that tests. They just take a little capsule, put it right here above in the throat, and they say, "Oh yeah, you're having acid reflux." Well, no duh, the pH of your throat's supposed to be 7, not 2, which is your stomach is supposed to be. And interestingly, when we were learning how to do NG tubes in the hospital, they said, oh yeah, the pH of the stomach can be up to 5 or sometimes 6 on PPIs. Your stomach is supposed to be battery acid.
What?
Hydrochloric acid, 1 to 2 pH.
Yeah.
But like, geez, I was like, inside my head, I'm like, okay, great. That sounds terrible.
Yeah,
You're not
really.
digesting your minerals, your protein. So diaphragm, so you can feel that on the feet.
Yeah, there's a
Okay.
specific go across. We go down, we encourage it to loosen up. So we're
Yeah.
going up and down on that thing. And I usually, when I do my zone, I wait to do the esophagus and the the valve at the, what'd you call it? The sphincter. That's
Lower
it, the
esophageal
word.
sphincter, yeah, the cardiac valve though, same.
Right, and until I've worked the diaphragm, and I wait until I do the vena cava also until after I've done, because that's the other orifice through the
You're
diaphragm.
right, yeah.
Yes, vagus nerve. I think, does the vagus nerve track?
I don't know if it goes through a hole. It might. I can't remember my
It's got to
anatomy
go
on it.
through because it goes all the way.
It does. 2/3 of our organs are innervated by the
Does it?
vagus.
Now I got to pull my book.
Yeah, I would like to as well, my
now I'm
knitter.
curious. But anyway, so yeah, you got those two things in that, and so your back alignment, your spinal alignment. There's so many things that can put that and have an effect on that. People with lower back pain, you know, it's like, do you have GERD? Do you have some
Right.
stuff going on? Because things are wonky in there.
So I know from my own experience and my husband's experience that getting a foot zone affects the entire body. It's not just like, oh yeah, I tell people it's like the best foot massage ever, and I know I'm like reducing it down to that, and it's not just that. I then say that it energetically closes your body like appropriately, like works through the systems in a way that feels energetically supportive to the system.
Yes.
And that's my like little spiel. And anybody that's done body work or experienced body work knows what I mean when I say that.
Yeah.
It's like you can, even a good massage therapist, like they close the energy gap so that you're not like losing out on one side. And if you haven't experienced this, I don't know how else to explain it except maybe get some more body work. Right? I don't know if you have a better way to explain
Well,
it.
and I have a lot of massage therapists that refer people because their clients want more footwork.
Yeah.
It's like it feels fab, and it's like, okay, well, go here because that's all your
Special.
That's your focus, you know, and you get an hour of that. So I know.
It's so divine.
Right? I know.
We all like stand on our feet too long, or like, I don't know, the feet are our foundation for ourselves. And whether we've got something like plantar fasciitis, which I have found factually to be associated, with like neck and shoulder issues.
that
Not
makes
always, but in a number of
sense.
cases.
Yeah.
Because that superficial back
The whole
line.
train, the whole, what is
exactly.
it? Body trails?
Anatomy trains.
Yes.
Yeah, for any of you anatomy nerds out there, Anatomy Trains shows the fascial lines in our body and how different fascial trains can be connected to different organs, so like, or different sections of the body. So like the voice, the jaw, the diaphragm, the pelvic floor are all part of the deep anterior line. So clinically, one of the things I see is if you've got tight jaw, almost always you're not breathing well and you've got squeezing in your pelvic floor.
Interesting.
And I'm wondering, so that would be the medial, the inside of the
Right.
foot, that you'd probably be able to feel those fascial tension.
Right. Yeah.
And doing that work. Oh, that would be interesting to send people to you that have jaw pain.
Oh yeah, that'd be cool. I can usually pick up on that too. We do the jaw
Yeah.
specifically on the again the big toe.
Yeah.
Because there's the neck and everything and the head and stuff like. And I can. It's like, ooh, what you got going on?
Yeah.
Do you clench your teeth?
You clench, yeah. It's common. It's a
Yes.
it's not stress relieving, but it's often a symptom of a person when they get
Right.
stressed. There's other pieces too, but we'll save that for listen to Jill's airway presentation that I had on our podcast.
Okay. One of my first and foremost things is getting people into that parasympathetic state, getting relaxed. That's when, to me, the body can really get the opportunity to reboot or to regroup or take a breath and just, that's when it heals. When we're sick, we sleep. Well, the body has to reprioritize and be able to have the energy to go heal. And so when people ask me, what can I expect and everything, I'm like, if anything, I want you to fall asleep.
Yeah.
Just chill out, do whatever, and just breathe and let your body take advantage of this. I don't know what it's going to use it for.
Right.
But it's going to use it.
So like there's going to be different, so when I've gotten foot zones, like there's different points on the foot that can generally be affected, but then there's like some spots, like my ribs were pretty consistently sore. Is like, do you find patterns for each person, or does it change every single time?
I think it changes. If there's a chronic situation and stuff, that will tend to come up, but sometimes I don't get the information. And when I say getting information, a lot of times it's energetic. I'll just feel energy move. Sometimes there's, of course, the response of the client, yipes, what are you doing?
Yeah.
Sometimes.
that hurts,
and the
yes.
second time you come around, it's gone. That was the information. That was the body taking the opportunity to say, hey, there's something going on here.
Yeah.
And for me, it's let's see if we can get energy to move there because it's not. So let's see what we can do with that. No pushing. I don't push it. It's just, here it is. You do with it what you want. And then there was another one. I forgot what it was already.
That's okay. So you brought up a good point. You're not pushing through the pain. One of the things that I learned about pain in school was that pain is stagnation or lack of blood flow, or the kind of the two, like a stale pond doesn't have good flow. And so pain really much feels the way you just described that. You did a little soft tissue, not even fully massage sometimes. It's just a little like, let's move this a little bit.
It's kind of just putting attention.
Yeah, exactly. And then that can help to clear that area of sensation so the body can integrate it, process it.
Right.
So that's interesting.
Yeah.
Do you work with people who have chronic pain issues?
I do. It just depends on how often they come back and stuff. And but yeah, a lot of plantar fasciitis. The attention goes to the feet when it's called a foot zone.
Yeah.
So people that have all these problems with my feet, neuropathy, tingling, all that, and it's like, well, I'm not going to tell you it's your foot.
Well, neuropathy might not be. It could be like undiagnosed type 2 diabetes, or it could be left over from a chemo treatment, or a car accident. There's like so many reasons why a person could have unrelated to their feet.
And it can be emotional too.
Totally.
Here we are in this realm of energy. Well, emotion is energy in motion.
Right.
It's supposed to be.
It's supposed to be energy in
emoting,
motion.
we are.
Yes.
So when we're not, and it sits there, then you run into that stagnation. You've got this frequency that's sitting there, and of course, pretty soon it's affecting all the cells. It comes into a physical presence at that point. And there's how many schools of thought out there that I kind of assign myself to too, is that pretty much all of our dysfunction and stuff has got an emotional origin.
Huge. Well, and
Yeah.
depending on what flavor, like in traditional Chinese medicine, they actually say that everything starts on the spiritual realm, moves into the emotional realm, and then the physical realm. If the body has to scream loud enough to get your attention, hey, now all of a sudden you got frozen shoulder. Almost everybody that I've seen, I saw 3 patients when I was in school with frozen shoulder, all 3 of them had significant mental emotional struggles and big like spiritual things, like they needed to quit their job or leave their husband, or they were all women, and you know, like that's a big thing to do,
Yeah.
to like quit your job that you've worked at for 20 years. That's a tough thing to sit there and be like, yeah, that sounds like you hate your job, your boss sucks, your coworkers are terrible, like, and you're still there because, oh well, you know.
Yeah, I only have 10 more years and then I retire. I got the
Exactly.
golden carrot or whatever.
Right.
Yeah, and it's like, oh yeah, well, what kind of health are you going to be in 10 years?
Right.
Yeah,
Right.
there's a price.
There is a price, and I really do feel like what I see clinically is things start on that spiritual realm, and then they manifest. And I don't always get to have that conversation with the person in the office, but I really enjoy when I get to have those
Yes.
higher level conversations, and like we've moved through the different layers and now we're here, and it's like, yeah, you're right, you know, I haven't been to church in 6 months and I'm not been spending time praying or whatever the thing is that feels good to them, whether they're Muslim or Sikh or Christian,
Yeah,
it doesn't matter.
whatever
Like whatever
there's-
flavor that they
right.
need in order to get that spiritual support.
Yeah, yeah. And it's kind of interesting too when, like you're saying, is where I am on the foot and what they're talking about.
Oh,
And
interesting.
it's like, oh, here I am on the lung and they're talking about their deceased mom.
Right.
You know, Chinese medicine,
Lungs,
lung
grief.
correlates to grief. And, you know, here it's pretty crunchy. I can literally feel crunchy.
Yeah.
And it's like, so, yeah.
And then suddenly they're talking about their mom that died 10 years ago. Yeah, it's so interesting when that
Yeah,
happens.
it's pretty fascinating. Yeah.
So okay, that's an interesting one. Like you help them kind of release it or bring that attention, and they then bring that emotion up themselves, and hopefully that, you know, that's softer the next time. I don't know about you,
Yes.
but I feel like most emotional or spiritual learnings are a spiral.
Yeah.
Would be nice if it was just simple, but you know, the spirit spiral is like, next layer. Thank you so much, universe.
Yeah, I agree. It's fun too because even the first time I'll come around a signal, you know, I'm like, hips. Hips are a big one. You know, people kind of, you know, ooh, what are you working on? At least that. And the tendency to think, well, you know, I need to do something to release that. And it's like, well, I don't need to up my pressure or anything. They're tolerating what I'm doing right now.
Right.
They're fine with it. And the second time I come down and do that movement, it's completely different. So it's like sometimes it's just that initial response. The body speaks, does what it does, and then it changes.
Yeah.
And that's kind of the miracle or magic.
For sure.
Yeah.
A family member that saw a foot zone person, she was pretty amazed. She was like, yeah, you know, she was working on something and all of a sudden my hips were really sore the next day, and then they felt great. And she was like, I don't understand.
Yeah.
And it's like, I don't fully understand either, but I know, you know, the song I tell my patients is like head, shoulders, knees and toes, knees and toes. I was like, we're all connected. So it's like, it
Yes.
doesn't surprise me anymore when someone says something like, yeah, I got a foot zone and then my hips felt weird and then the next day I was fine. Mm-hmm. I felt better actually. Like I had a little more
in
motion.
my world with energy, with frequency and vibration, it can be something totally unrelated.
Totally.
You know, just a completely different body part or something that's actually resonating and disturbing the vibration of another functioning system or organ or group of cells in whatever shape. And I've had so much of that happen, and it's really cool to realize, to remember, you know, it doesn't have to be this linear thought. It doesn't have to be just what we see or just what we understand, what works with each other.
Yeah.
Because energetically, it's,
I can't always explain it. And I know this is like, some people are going to be like, what the heck are these people talking about? And it's like, unless you've had those experiences, and I'm a little more sensitive. I'm also, you know, got quite a bit of water and Pisces in my chart. Yay, you know, for wanting to be super scientific. And then I have this like gift of like this sensitivity to the energetic realm as well. And, you know, the type of technique that I use that helps me listen to the emotions is visceral manipulation. And I can feel, I'm like, you're a worrier, aren't you? And they're like, oh yeah, my whole family, we're all big worriers. Like, it's like a badge. And I'm like, I get it, but also like it's affecting your guts. Like we got to unwind this and like, how can I help you? And again, having that like highest intention that I'm not doing it, that I'm here to help support the body. That's a tricky balance to have. What have you found to help you, keep your ego, so to speak, out of that?
Well, it's been a learning process.
For
Way
sure.
back early days, it was like, oh, everybody should have this. Everybody can heal. The body can do it. Is
In
miraculous.
theory, yes.
Yeah, but then it's through life and stuff, I've realized I don't get to be the person to say what is their true path. We're all here temporarily, and there's all things we have to experience, and sometimes that person's demise from whatever chronic issue or whatever is their healing.
Yeah.
So I don't know, at some point I just finally realized I don't get to say who's doing it right or wrong. I might have my moments where I'm like, please don't eat that. But
Sure.
it's, ultimately it doesn't matter really what I think.
Yeah, it's our free will.
And it's so much easier when I step out of it and just say whatever information I get, whatever. Sometimes I get information and I know that I'm not supposed to share it with the client.
Oh, interesting.
And it's like that's okay. And if I'm doing some of the energy modalities and I can have a label to a frequency of an emotion, I'll ask, is it appropriate for them to be told what this is? Because what will happen is people will immediately, even though it's blocked, and I'll tell them, this is not current, immediately they associate it with current events and stuff, or and identify with it. So once that identity connects to it, it's like, well, then how do we release this?
Right.
Because it's so integrated into who they think they are, who they understand themselves being. So, what do you can't change that. They have to do it. It's their thing. Yeah. So, you can suggest or just say, you do with it what you will.
Yeah.
Yeah. And I don't know how many times in my life somebody has said something to me and like 15 years later I get it.
For sure. I feel like I just had something like this happen to me last summer where someone said something and I was like, oh, I finally understand what they meant. And it's like, it comes to me, I'm like reading something and it's usually something philosophical and it's like applying it, whatever, but I wish I could remember what it was because I was like, oh my God, that person told me that so long ago.
And you can almost hear them saying it again too. You just connected somehow, and it's like it's not going away. So it hasn't served its purpose yet. It's coming. Yeah. I love those.
I mean, they're awesome. It's like so. One of the things about naturopathic medicine that I really love, and again, I don't get to do this higher level of work very often, but Henry Lindlar was a medical doctor back at the end of the 1800s, early 1900s, and he said the purpose, and Samuel Hahnemann, a homeopath, also said this too, the purpose of a physician isn't to help people with sicknesses, it's to help them get to their highest potential. That top of Maslow's hierarchy, the self-actualization. And what that looks like for everybody is different. Maybe they're the best construction worker in the entire area and like that's their gift to the world. Or maybe they're the most brilliant violin player or landscaper or whatever it is that their gift is. Like it doesn't always have to be something that you or I value.
Right, like this famous thing.
Right.
Yeah.
Exactly. Or, maybe it's just being a great parent, having 6 kids or whatever. Like, that's a big deal. And how can I, as a practitioner, help that person achieve that? And, this has been the piece that's been the biggest learning for me is like, I want to go there right now. And that's like, it takes time to learn, but it's layers. And maybe they're not ready right now. Maybe in 10 years, maybe this is where they're at for this lifetime. And who knows?
Exactly.
And maybe they'll come back around in 5 years and like, it'll be totally different and they'll be ready for the next layer of self-actualization or self-responsibility. I feel like there's a lot of like taking ownership of things and not allowing labels, because we were talking about like, oh, I'm taking this emotion or I'm taking this diagnosis and owning it.
Yes.
It's my identity,
Yeah.
which is quite dangerous in medicine, in my opinion.
Yeah. And I love to encourage people and just whatever they're doing. It's like even the fact that they're coming and giving the opportunity for this technique.
Yeah.
It's like, this is pretty significant. You've stepped out of a box that you have accepted for how long, as when it was handed to you.
Yep.
If it's a chronic thing, or this is the way your life is going to be. It's like, kudos to you, and it's not.
It doesn't have to be.
You get to change it.
Yeah.
And so I really love doing that part, and just going, I admire you so much for what you're doing.
Yeah.
And as you pay attention, you'll see the changes. So it's also allowing that too,
Yeah.
to see it. And
Say 3 things the NDs do: help the body take out the trash, give the body what it needs, and then we get out the way. This, my brain, your brain, anybody else's conditionings about the situation. And I would say that's probably the hardest piece to do, is for us to just lean out and allow the process to happen.
And it's like, how much do you want change?
Yeah.
What are you willing to change? And how much space are you willing to give that change to? And we all do that. Maybe every day,
Yeah, I read a quote recently. I think it was in Standardized Naturopathy, and it was an Albert Einstein quote, and it said, while you're doing something, and it's kind of thinking about the flow state, you shouldn't be conscious of it. You should just be doing the thing, you're in with it. That's allowing yourself in the moment. And I read it a couple of times, and I was like, oh my God, it's like when I go snowboarding and I'm just snowboarding and not thinking about snowboarding, I'm so much better than when I'm trying to like mental my way through the don't hit the trees, like just follow the path, just let the body.
Right.
And I'm using a sports example, but the body also has that capacity if we allow it to. And I know people that have had like crazy diagnoses, and then suddenly they have no more diagnosable health conditions. And it's like, wait a minute, you just had like 10 things, you were on a bunch of medication, and now all of a sudden you're like totally fine. What happened?
Right.
What changed? Stepping outside that box can be pretty profound.
Yes, absolutely. And because it's a significant box in our culture and our medical culture and stuff. I think I kind of remember in my lifetime when I started seeing the medical world starting to be more pragmatic and truthful. We're not going to hold out hope because we can't guarantee it or anything. So we're just going to lay it on the table. Right. But now it's like they have taken hope away.
Definitely.
And hope is so powerful.
It is.
Hope is knowing it can be different to me. That's kind of my understanding to hope. It's huge.
It is.
It's huge. And if you don't think that you can make anything different,
you definitely
when would it happen? Yeah.
Well, and like you said something earlier too, sometimes the path isn't healing, sometimes the path is ending this physical body. And that's a tough reality in medicine for people. It's like you have all these health conditions, and I'm thinking about a movie I saw years ago about an ayahuasca retreat, and there was a gentleman, I'd never heard of this type of cancer before. He had neuroendocrine cancer. Hormonal nervous system cancer. That's pretty much throughout his entire body. Okay, it was not a good situation. So the shaman, they went down to the jungle to do ayahuasca, these like 12 people. The shaman put this man in a hut away from the rest of people and said, you need to be by yourself. And he died. He died down in the rainforest. There was no amount of healing. There was no medicine that could happen. Like that was the process for him.
Right.
And he was in the process of unfurling this physical body. And that's hard for those of us that get left behind. But having that deeper philosophical or spiritual belief that like, we go on, our soul goes on. Like this body is finite, but our soul is infinite.
Right.
And in that case, I was like, wow, that is a pretty gnarly type of cancer.
Yeah.
And for the shaman to be like, you don't need medicine, you just need to be by yourself.
Wow.
Is pretty profound.
How wonderful for that guy to have had that experience.
Yeah.
And not have been butting his head and butting his head and butting his head against what was the inevitable.
Right.
And for all of us. And, this resistance is kind of absurd.
It is. I mean, staying alive at all costs. It's like, but what's the cost?
Yeah.
It's like, and every person's going to have different because of their value systems. But I want to be able to feel good. And so if that means I'm going to step outside the box and try something, I'll be flippant and say woo-woo. I don't think a foot zone is very woo-woo at all, but maybe somebody in this
We
conversation.
can make it that way or not.
Or not.
Whatever.
Like, hey, it's my foot, and like that spot on my foot hurts, and like you're telling me it's my low back or my eyeball or whatever. Who knows? Maybe you poked a stick through your eyeball when you were a kid, and it's like, oh yeah, that makes sense, right, for that person. It's like, yeah, we have to. I like there to be space. Not everybody has to, and like, thank you for reminding me that we don't always get, because I would love everybody to see a naturopathic doctor. But you're right, not everybody's the right fit.
Right.
And it's not the right time, it's not their journey, it's not their purpose, or whatever it is.
And I'm sure there's people that think, have the judgment that, oh, I can't believe he did that.
Right.
I have a friend that passed from cancer. She made a choice to not do conventional treatment.
Yeah.
And she struggled with it. She was like, how do I do this? She was a healer. She was magical. She's like, I have all this energy, all this stuff, and I have conventional medicine. What do I do? And I'm like, well, why do you have to choose between them? Aren't they all tools here in the now, right now?
Yep.
And you can pick and choose. Your body will tell you. She chose not to do anything, and I totally honored that.
Yeah.
And it was like, I think we should all have that choice.
Capacity. But there is, especially, cancer is one of those ones, and this is why I don't see people with cancer in my practice, just to avoid the political shenanigans that can come with it, is like, there's some judgment that if you choose to not do conventional treatment, whether you're working with a different practitioner or not, there's judgment with your friends, your family. Oh my God, you have what? And you're not doing chemo?
Today, I mean, I think she died in 2012 or something.
man.
Today, somebody else could say to me, well, I just can't believe she just...
Yeah.
I was like, well,
I can.
Have you ever been in that position?
Right.
Then maybe you don't understand.
And understand people have different values.
Yeah.
And that's really what it comes down to with a conversation, is what are your values? And that's maybe what differentiates a person that ends up in your chair and ends up in my chair, is they have different values. And while there might be some distrust of the larger systems that exist right now, there's someone that wants something different.
Right. Yeah.
And that's a value.
That's true. Thank you for that reminder. I can use that.
I mean, it is.
The fact that they're there is information, whether what the words are representing and stuff. The fact that they're in that chair says a huge piece. So thank you for that. Yeah.
So a little more on foot zone. Is there any benefit? Okay, so the bottom of the foot is more the organ systems. We have paired organs and we have single organs. Do any organs kind of go across both feet? Like half the liver, half the liver?
Yeah, there's a tail. The liver, stomach, and pancreas. There's a piece of the liver that'll come over onto the left foot. And then the pancreas and stomach, both we hit on the right foot, even though they're on the left side typically of the body. So there is some crossing of the midline in there. Of course, the small intestine and large intestine. And, just a thing too, because we're working individual organs and then we're also working the system that the organ is a part of. So we do the kidney, but we're also doing all the, the ureter, your urethra, bladder, the whole thing. After a foot zone, it's so common to have an amazing bowel movement or an amazing pee.
Those big release pees. We all know that
people
feeling.
are like, what happened? It's like, oh, that's awesome. That's great. Because to me, that's a response too. That's the body taking that tool and saying, and it's amazing sometimes getting onto that large intestine or the small, and it's like, there's, yeah. I mean, you should take a break for a little bit or something and let this thing do what it needs to do. Or how much water do you drink? The large intestine specifically, how much water that organ uses. And it's like, you gotta, if you're stuck, go drink 16 ounces of water and see maybe what might happen.
Yeah, it's important.
Yeah.
Minerals, soluble fiber.
Yes.
Too. Yeah, there's but you're right. And especially when it's winter, a lot of us are not drinking enough water because it's not so hot. So we're not reminded oh my God, I'm hot. I need to drink some water. But it's actually, and my previous guest, Dr. Jin Mi, she's a colleague of mine. She helped me understand why the cold makes it so much drier. And it's because it just drops any form of humidity that's in the air. So then it just dries everything out. There's much less movement. more stagnation.
Yes.
This is why cold food adds more stagnation to the body.
Really? Mm-hmm. Wow.
Appropriate in the summer, maybe not so in the winter.
Yeah.
Depending
but
on
don't they drink
constitution.
like espresso and chai and stuff in the hot, like in the Middle East and stuff, because it triggers the body to lower its temperature with hot drinks?
Good
Somebody
question.
told me that one
It wouldn't.
time.
I don't know. I can't speak to that.
Yeah, they're like, you take an espresso, of course,
Yeah, Turkish
caffeine, yeah.
Yeah.
But yeah, it was like that's what they're not drinking ice water, iced tea or anything. They're drinking a hot, not a big amount,
Yeah.
but a small amount, and it sets the body, it like, I don't know, resets the thermostat
I
or
could
something.
see. Hold on, I could see this like understanding for primary and secondary responses. Thinking about hydrotherapy, when we do a cold towel on the skin, it actually makes the skin warm even though it's cold. Because the body's like, wait a minute, why is it cold? I'm going to send blood there.
Exactly.
And so I wonder if it's the
Yeah.
same. We're going to have hot, and then the body's going to like start to like, send cool down by sending out cool to the periphery.
Yeah, see, that kind of makes sense to me.
Yeah, secondary responses. Oh, hydrotherapy is so great. Yeah, foot zones. So one of the other things that you brought to my attention that I will talk about in another podcast is light therapy, and that's something you use sometimes with your foot zones if the clients want to.
Yeah.
Tell me a little bit about light therapy.
Light therapy, well, red light, FDA cleared. But it is proven scientifically that it activates the cells to make nitric oxide, which is a life compound for the spark or the energy of the cell. And so, a lot of us apparently are pretty deficient. And 20 minutes of red light for pain, typically, if you're grandfathered into the nanometers and the requirements of the red light therapy, it's grandfathered in for treatment of chronic pain and wound and injury recovery. And it's astounding how much faster the body will heal with some red light. So the equipment I use has an array. It's yellow, red, blue, green, orange, near infrared, far infrared. It can be programmed from 10 hertz to 9,999 hertz. So on top of the light going in at different depths with different colors, it's tuning the cells too with frequency.
Interesting.
That's huge, very unique. With the foot zone, because the lights can be so relaxing, it can reset so much, and gosh, the response of the body to the light it can be all over it just depends on what the body needs.
Yeah.
And the two consecutively is my favorite thing to do because
Doing them together.
yeah,
They pair well.
The body here, you've got the light that's feeding the cells to be able to do their job and to reproduce healthier cells. Yay. And then you're giving the body the support of the system and physiology of the body and how it all communicates and works together. I just love that.
Yeah.
To me, that's the ultimate.
It's just such a gentle therapy. And if it was more accessible, and so you and I, we've chatted about like, you close your eyelids and you're outside and it's sunny. Why? Like you can see the red light through. Like we are deficient in red light as humans. We're supposed to have it because of the sun. And now the sun is somehow this most dangerous thing. And I'm not saying it's not, like, everything is dose dependent.
Yeah, there's...
And we live in a high climate where it's like a pretty potent sun. Regardless, we still need red light. It is supportive nitric oxide production, mitochondrial, which is the powerhouse of our cells. Energy production happens there. And if we're not getting enough red light, our mitochondria aren't able to do their job as well.
And you put sunglasses on. What happens? You're not getting the red light anymore.
Nope.
It was built that way.
It was. So this is
purpose.
So this is a crazy thing, and I've gotten in trouble from some colleagues because they're like, "Where's your PubMed paper to say that sunglasses are bad for your pineal gland?" And I'm like, "Okay, do an experiment." Because I did. I was one of those people that couldn't function without wearing sunglasses outside ever.
Right.
24/7. If I was outside,
Too
sunglasses
sensitive.
were on.
Yeah.
And I gradually started taking them away. I'm like, okay, if I'm driving, I can do them. And this has been since we've been back in Colorado since 2020 that I've been doing these little experiments with myself and sunglasses. And to the point where I almost can't even wear sunglasses anymore.
I know.
Because like I've gotten used to it.
Yes.
without them. It's like I desensitized myself.
Well, I think it affects the health of the cells too.
Hugely.
I mean, that's what the red light's doing, is increasing the health and the activity and the functionality of the cell.
Calming your nervous system.
Right.
I really feel like that's what it was. Is like my nervous system was so like that I couldn't handle that, and so then it was just like a little bit at a time. I get sunburned much less not wearing sunglasses.
Yes. You know what?
That's
oh
a
my
really
gosh.
interesting thing that I've noticed the last couple years, and I do snow sports and water sports, and I at least be intentional to take them off while I'm on the chairlift or for like 10-minute periods while I'm on the boat.
Yeah.
And it makes a big difference.
That's about the only time I wear them. I've got blue eyes. Blue eyes are extremely sensitive. So I've worn sunglasses basically all my life.
Same.
Well, when
Squinty
I
eyes
got
in
like a
pictures.
teenager and they were cool or something, I'm
Sure.
not sure. But with the red light therapy and having had it in my personal world for so long, I don't need them. You know, my eyes will get tired, like they get overstimulated on the water or snow.
Yeah, the reflection is just so harsh.
Yeah. So or driving, you know, and then I kind of stare. So there's time and place for them, but I used to I put them on before I would head out the door.
Same.
And you think about it, the optic nerve and the functionality of the optic nerve, the vision center being all the way to the back of the skull. So it is built to take red light all the way through the brain. Yeah. So everything inside the brain is getting this red light. So mood, huge for mood.
Huge.
Yeah.
Well, there's mood, and then I talk about it with patients from the cortisol, melatonin,
Yes.
circadian rhythm perspective, which hugely affects mood too.
Yeah.
If you're not sleeping well, there's this whole dysregulation that happens. It's more inflammatory when your cortisol is high, or you're working a night shift. Like, there's all these things, and we know that night shift work is carcinogenic. Like, it's not just bad for you; it's like actually carcinogenic.
Wow.
Isn't that insane?
Yeah, definitely.
I really hope more people, and again, knowing we live in Colorado, we live at altitude, it's high UV, the sun is just,
It can be brutal.
It can be brutal.
Yeah.
And I like that you say time and place. When I'm driving, snow sports, water sports, those are my exceptions, but I invite people to do this experiment, 10 minutes. Take it off when you're on the chairlift, take them off 10 minutes every once in a while, every hour or so while you're on the boat, and it can make a big difference.
I wish that when the media says, talks about vitamin D, and it's like, okay, so this is how long you need to at least expose your arms to direct sunlight to create enough vitamin D, blah, blah. It's like, I wish they said, and take your sunglasses off and close your eyes.
Yep, that's what I tell people.
Sit in the sun for 10
No
minutes
sunglasses.
and just do that.
Yep.
And it's amazing. Of course, taking that 10-minute break is pretty phenomenal too.
Yeah, the break.
From whatever you're doing, that has a huge effect too. But there's a lot going on.
Yeah.
Yeah, it's the light is profound. It is creation to me. We wouldn't have any of this without it.
Yeah, and then there was light. No,
and
it's
it absolutely complements every modality that I do. Because the body just is like, oh yeah, bring that
this,
on.
yeah, because we need it, and it helps to restructure the water in our body. Like we're mostly water. We're like 70-something% water.
Yeah.
We cut our arm open. We're not bleeding water. We bleed blood. Blood is a structured substance. Are you familiar with structured water at all?
Keep talking and let me see.
So Gerald Pollack is the one that kind of like coined this term. He's a PhD scientist at University of Washington in Seattle, actually. You can tell he's quite the professor. He's a very good speaker. And he wrote the book, The Fourth Phase of Water. And I've heard him speak a couple of times, and he's really got me understanding. He's used basic physiology experiments to prove that this exists. So again, we'll use a pond that's got an outlet and an inlet. If it doesn't have the outlet and the inlet, the pond does what? Stagnates. And it dies. It smells bad. But if it's got that movement, you can tell. And if you've ever been around a pond and you can see, it's moving, but you can see the water, it's got a density to it, a texture.
Yes, yeah.
That's structure that's been added to it. It's not just dead water.
Right.
Our body has that as well. So sulfate had structure. And what's really interesting, I try to remember, don't hold me to this because I'm not going to remember the dirty details, but when we get red light, it affects our ability to make sulfate more efficiently, more effectively. If there's someone that is listening that knows this physiology better than I do and wants to correct me, please correct me because I know I'm going to mess it up somehow. But somehow the light affects our SO4. Oh my God, sulfate. I was like, I can't remember it. And it allows us to have more structure, more like flow. It's, yeah, I don't know how else to explain it, but it's better for our body when things are more structured. They have a liveliness to them.
I kind of think of like muddiness, like you have, and it could be frequency too, energy or whatever,
Yeah.
but water is a great physical analogy of it, is where, yeah, you've got a muddy, laden current of water over here, you've got a clean current over here, you've got one that's got grass and stuff in it over here, and they're delineated.
Yeah.
There's, if it was all mixed together, it would be chaos, kind of.
Kind of,
So
yeah.
that structure thing, I mean, that's kind of where I'm going with
Yeah,
that.
yeah,
I'm
yeah.
not sure.
It does. It
Yeah.
helps things be in the right place in the right amounts. So, like, I see a number of patients that have low blood pressure. I'm actually, in our conversation, I'm wondering if I should make a recommendation for them to spend more time outside to help structure their blood so it's a little more
yeah.
tonified, or get access to a red light of some sort. Oh, that's really an interesting thought.
I wonder if there's any data out there on that.
Yeah, I don't know if there is or
I know,
not.
you know, when the claims for the light is better circadian rhythm, better increased
Yeah.
circulation.
And
which
there
would
is
that
PubMed.
be?
There is
Yeah.
PubMed.
There's
like
a ton of
red
stuff
light
out there.
and TBIs, traumatic brain injuries. There is a lot of good data on it, and like
Huge.
because of you, you've gotten me to that. Like you helped me be able to find it, and like I'm blown away that it's not standard of care for any kind of traumatic brain injury or lack of oxygen event, because it is that profound.
Absolutely.
But it's like it's such a
And that could even be an emotional blow.
yeah. You're right. But well, here's the thing. It's like red light, it's not surgery. You're going to tell me
know.
that standing in the sunlight or standing by this red light is going to make that big of a difference? It doesn't seem like it, but yeah.
Yeah. And depending on the depth of the chronic level that people are dealing with and stuff, depends.
Yeah.
It is something that I think we need every day. I know we need every day.
We definitely need it every
Yes.
day.
So
Like, we were
but
not
if
made
you're
to live in
starting at a
boxes.
foundation of health way down here and you want to get here, well, you got to concentrate on and give it what it needs to
Yeah.
get there.
Yeah.
You know, that's a hard question. I don't know what you get from people, you know, how often do I have to come or whatever.
Yeah.
It's like, wow. You
It
know,
depends.
I don't know the answer to that.
I don't. But man, I'll tell you, 10 minutes, if I could get a patient that's having sleep issues, I'm going to play around with this low blood pressure thing actually, and maybe high blood pressure too. Tell not taking meds away, people.
Right.
You know, we'll do things appropriately, but spending 10 minutes 3 times a day, morning, midday, and evening, right around the time dusk is happening, and seeing if that has an effect on people's blood pressure. To like
Personally, I
help
think
things normalize
sunrise
it.
and sunset do.
They're the best. Oh my God,
There's
every day is
just
different.
something that
Yeah.
it's magic time.
It is.
Yeah.
We get to
And I think
absorb.
that would be pretty profound.
All right, all right. Foot zones, light therapy, these are all really lovely things. How can my followers or how can my listeners find you if they want to get in touch?
I do have a website. It's quantumfootzoning.com. And you can schedule from there. There's a bunch of information on the myriad of modalities, and or call or text me directly. I'm getting a few more people using the website, but it's and that's. Do you want me? Should I give them?
You want? I can put it in the show notes.
Yeah,
It's your business number. Yeah.
970-531-3244.
244. Yeah, so we talked about foot zones. The foot has 4 different zones. They affect 4 different areas of our body. And then the bottom of our feet is that 4th zone, right, that has the organs.
Yeah.
And then, we nerded out on a couple different like anatomy things. Okay, I got to go check my netter about the vagus nerve. And then we also talked about some energy things and some emotional things and spiritual things. It's like, I know these are like higher level conversations, but hopefully they'll be helpful for, one of the people, so at least one person. That would be great.
Yeah.
And then we talked about light therapy, and it's not just red light, although it's red light that's the light that is approved by the FDA.
Absolutely.
Yeah. For
The
healing
other ones,
injuries.
it's just the depth that they go into the body, into the soft tissue and stuff. And the near infrared and far infrared is kind of newer technology. When I first started with my light equipment, we didn't put near infrared on the eyes, and now it's in the eye mask to do that with. And the newer pads that they're putting out have far infrared in them too.
Interesting.
So science, it's exploding with light, which to me makes total sense because
Yeah.
there it is.
It is.
So yeah, it's like, okay, well, let's find out. And I think the symbiotic relation, I mean, there's just so much, and the body can heal itself.
If it's
given the right tool,
exactly.
Man, it's incredible.
It is. So if you guys like this episode, share it, subscribe. If you found something controversial or you want to correct my physiology on the sulfate, whatever, I know I messed something up there, let me know. Drop it in the show comments. Let's chat about it. That's how I learn. But for me to continue doing this, I need more subscribers. You know, I really love putting out this information. And you want something free? You don't have to buy a fancy red light that you see all the time on social media. Go stand outside. Even if it's rainy and cloudy, you're still getting that radiation from the sun.
Don't look at it directly. Close your eyes.
Exactly. Don't stare at the sun. We're not talking about sun gazing here, people. But good clarification.
The blood in the eyelids that is making the red light. So, yeah.
So, thank you guys so much. My next guest, we're going to be talking about mindfulness. She's another local here in Montrose. And thank you guys so much for joining.
Thank you for having me, too.